The tongue is an incredible part of our body, not only responsible for the taste of food and speech, but also capable of revealing a lot about our health. Often, seemingly simple signs on the tongue can indicate underlying issues in other parts of the body. In this video, we'll explore 10 signs that the tongue can exhibit and what they may signify in terms of health. So, get ready to discover how this small part of our body can provide significant insights into our overall white or coated tongue. When we observe a tongue with a white or coated appearance, it can indicate a buildup of bacteria, fungi, or dead cells on the tongue surface. This condition is often associated with poor oral hygiene, where these microorganisms find a conducive environment to thrive. The buildup of bacterial plaque on the tongue can not only result in a white or coated appearance, but also contribute to bad breath. Additionally, this condition may be a sign of digestive issues, intestinal imbalances, or mouth infections. Maintaining good oral hygiene is crucial to prevent and treat this problem. This includes gently brushing the tongue during toothbrushing to remove bacteria buildup and food debris. Furthermore, it's important to maintain a balanced diet rich in fiber and nutrients and avoid excessive consumption of sugary and starchy foods, which can fuel mouth bacteria. Adequate water intake is also essential to help keep the mouth hydrated and stimulate saliva production, which is important for oral health. If a white or coated tongue persists despite good oral hygiene and dietary changes, it's important to consult a dentist or doctor for proper evaluation and treatment. Yellow tongue. When the tongue exhibits a yellowish hue, it can be a warning sign for liver or gallbladder issues. The liver is responsible for producing bile, an important fluid for fat digestion. When liver problems occur, such as bile duct obstruction or liver dysfunction, bile may not be adequately released, resulting in accumulation in the body. This can manifest as a yellow tongue due to the deposition of bilirubin, a bile pigment, on the tongue's surface. This condition, known as jaundice, can indicate a variety of problems, including hepatitis, cirrhosis, gallstones, or even liver cancer. Additionally, excessive consumption of foods with dyes or smoking can also contribute to the yellow discoloration of the tongue. It's important to be aware of other symptoms that may accompany the yellow tongue, such as yellowed skin and eyes, dark urine, and light-colored stools, as this may indicate a more serious liver problem. If you notice persistent yellow discoloration on your tongue, it's essential to consult a doctor for a comprehensive evaluation and accurate diagnosis. Treatment will depend on the underlying cause, so seeking appropriate professional guidance is crucial to address. And before we continue learning about health and wellness, don't forget to subscribe to the channel for more informative content like this. Like, share, and turn on notifications. Red or sensitive tongue. A red or sensitive tongue can indicate various health issues. One of the causes may be nutritional deficiencies, such as lack of vitamin B12 or folic acid. These vitamins are essential for tongue health, and their deficiency can result in a red and sensitive tongue, along with other symptoms like weakness and fatigue. Additionally, a red or sensitive tongue can be caused by mouth irritations, such as excessive use of mouthwashes, aggressive brushing, or consumption of very hot or spicy foods. Exposure to food allergens can also trigger an inflammatory reaction in the tongue, resulting in redness and sensitivity. Viral and bacterial infections can also cause tongue inflammation, leading to its redness and sensitivity. This can occur, for example, during respiratory infections like colds or flu, where the tongue may become irritated due to mucus production and frequent coughing. It's important to observe other symptoms that may accompany the red or sensitive tongue, such as pain when swallowing, mouth sores, or fever, as this may indicate an underlying infection that requires medical treatment. To alleviate tongue redness and sensitivity, it's important to maintain good oral hygiene, avoid irritating foods or substances, and ensure a balanced diet rich in cracked tongue. When the tongue exhibits fissures or cracks, it may be known as a fissured or cracked tongue. These fissures can vary in size and depth and are generally not a cause for concern, but in some cases, they may indicate underlying health issues. One common cause of a cracked tongue is dry mouth syndrome, where there is a decrease in saliva production. Saliva is important for keeping the oral mucosa moist and protected, and its absence can lead to tongue dehydration and the appearance of fissures. Another possible cause is vitamin deficiencies, especially vitamin B, iron, and zinc. These nutrients are essential for oral mucosa health, and their deficiency can lead to tongue dryness and fissures. Additionally, conditions like psoriasis, an autoimmune disease that causes inflammation and scaling of the skin, can also affect the tongue, leading to the appearance of fissures. It's important to keep the tongue hydrated and avoid irritants like tobacco and alcohol, which can worsen fissures. Drinking plenty of water, chewing food thoroughly, and maintaining a balanced diet rich in vitamins and minerals can help prevent and treat a cracked tongue. If tongue fissures cause discomfort or persist for a long period of time, it's important to consult a doctor or dentist for a comprehensive evaluation and appropriate. Swollen tongue. When the tongue becomes swollen, it can be concerning and indicate different health conditions. One of the most common causes of a swollen tongue is an allergic reaction. This occurs when the immune system reacts excessively to a foreign substance, such as foods, medications, or insect bites, resulting in tongue swelling and even difficulty breathing. In addition to allergic reactions, a swollen tongue can be a sign of inflammation, which can be caused by various conditions, including viral or bacterial infections. Other possible causes include tongue injuries, such as accidental bites or burns, and other underlying medical conditions, such as hypothyroidism or angioedema syndrome. If you notice that your tongue is swollen, especially if it's accompanied by other symptoms like difficulty breathing, rash, or intense pain, it's important to seek medical attention immediately. In cases of severe allergic reaction, known as anaphylaxis, tongue swelling can be potentially life-threatening and requires emergency medical intervention. Treatment for a swollen tongue will depend on the underlying cause. In cases of allergic reactions, medications like antihistamines or epinephrine may be administered to control the immune response. For conditions such as infections or other medical conditions, treatment may include medications to reduce inflammation and alleviate symptoms. It's important to consult a doctor for an accurate diagnosis and a proper ulcers or sores on the tongue. The presence of ulcers or sores on the tongue can be quite uncomfortable and indicate different health problems. These sores can be caused by various reasons, including viral infections like oral herpes or bacterial infections. Additionally, nutritional deficiencies, such as lack of iron or vitamin B12, may contribute to the development of tongue ulcers. Other factors that may cause ulcers include traumatic injuries, such as accidental bites or aggressive brushing, and irritations caused by very hot, acidic, or spicy foods. Underlying medical conditions, such as autoimmune diseases, may also predispose a person to develop tongue ulcers. While most tongue ulcers are benign and heal on their own within a few days to 2 weeks, it's important to closely monitor them. If ulcers persist for longer than normal, increase in size, or are accompanied by other symptoms, such as fever or intense pain, it's essential to consult a doctor. Treatment for tongue ulcers may vary depending on the underlying cause. For ulcers caused by viral infections, antiviral medications may be prescribed to help reduce the duration and severity of symptoms. For ulcers caused by nutritional deficiencies, vitamin supplements or dietary changes may be recommended. In some cases, topical medications may be prescribed to relieve pain and promote healing. It's important to remember that any tongue sore that doesn't heal within 2 weeks swollen or inflamed taste buds. Taste buds are small bumps on the surface of the tongue responsible for containing taste receptors, which allow us to sense the flavors of food. When these taste buds become swollen or inflamed, it can cause discomfort and affect the sense of taste. There are several reasons why taste buds may become inflamed. One of the most common causes is irritation, which can occur due to consumption of very hot, spicy, or acidic foods. Excessive use of tobacco or alcohol can also irritate taste buds and cause inflammation. Additionally, taste buds may become inflamed due to bacterial or viral infections in the mouth. These infections can be caused by various factors, such as poor oral hygiene, sharing food utensils, or close contact with infected individuals. Another possible cause of inflamed taste buds is an allergic reaction to certain foods or substances, such as food dyes or preservatives. This reaction can lead to inflammation of the taste buds and cause discomfort on the tongue. To alleviate inflammation of the taste buds, it's important to avoid foods or substances that may irritate the tongue. Maintaining good oral hygiene, including regular tongue brushing, can also help reduce inflammation. In more severe cases, it may be necessary to consult a doctor for additional treatment, such as the use of medicinal mouthwashes or topical medications to reduce inflammation and discomfort. If inflammation of the taste buds persists for a long period of time or is accompanied by other symptoms, such as intense pain or difficulty swallowing, geographic tongue. Geographic tongue is a benign and relatively common condition characterized by irregular patches on the surface of the tongue that resemble a map. These patches can change in shape, size, and location over time, giving the tongue a geographic appearance. Although the name may suggest a relation to geography, geographic tongue is not related to geography or any specific area. The exact cause of geographic tongue is not fully understood, but it's believed to be related to genetic factors, autoimmune predisposition, or allergies. Some research suggests that this condition may be associated with an inflammatory reaction in the tongue, resulting in loss of taste buds and discoloration of the mucosa. Geographic tongue is generally a harmless condition that does not require specific treatment. However, it may cause discomfort or sensitivity in some people. To alleviate symptoms, it's important to avoid irritants like very hot, spicy, or acidic foods, which can aggravate tongue sensitivity. Maintaining good oral hygiene is also essential to prevent tongue irritation and inflammation. While geographic tongue is not harmful to health, it's important to monitor any changes in the tongue and report any new or concerning symptoms to your doctor. In some rare cases, geographic tongue may be associated with underlying medical conditions, such as autoimmune diseases or fungal infections, which may require specific Persistent bad breath. Persistent bad breath, also known as halitosis, is a condition in which a person experiences an unpleasant odor in their breath chronically. This condition can be embarrassing and negatively affect quality of life. There are several possible causes for persistent bad breath. One of the most common causes is poor oral hygiene. Bacterial plaque builds up on teeth, gums, and tongue, releasing sulfur compounds that cause unpleasant odor. This can be exacerbated by cavities, gum disease, or poorly cleaned dental prostheses. Additionally, oral health problems, such as mouth infections, dental abscesses, or periodontal disease, can also contribute to persistent bad breath. Respiratory problems, such as chronic sinusitis, tonsillitis, or lung infections, can also be causes. Underlying medical conditions, such as uncontrolled diabetes, gastroesophageal reflux disease, GERD, kidney or liver problems, and metabolic disorders, can result in persistent bad breath due to chemical changes in the body. Other causes include smoking, excessive alcohol consumption, a diet rich in strongly scented foods, dry mouth, xerostomia, due to medications or medical conditions, and even emotional stress. To treat persistent bad breath, it's important to identify and treat the underlying cause. This may involve improvements in oral hygiene, such as brushing teeth and tongue, using dental floss, and mouthwash. Regular visits to the dentist are also essential for professional cleaning and evaluation of oral health. Additionally, staying hydrated, avoiding strongly scented foods, changes in tongue color, bluish, pale. When the tongue has a bluish or pale color, it can indicate circulatory or respiratory problems. Bluish discoloration, known as cyanosis, occurs when there is low oxygenation of the blood. This can happen in situations like acute, such as asthma, pneumonia, or chronic, such as chronic obstructive pulmonary disease, COPD, respiratory problems, heart failure, or even carbon monoxide poisoning. Cyanosis occurs when the blood doesn't carry enough oxygen to the body's tissues. As a result, the lips, nails, and mucous membranes, including the tongue, may acquire a bluish color. On the other hand, tongue paleness may indicate a decrease in blood supply or anemia. Anemia occurs when there's an insufficient amount of red blood cells or hemoglobin in the blood, resulting in a reduction in oxygen transport to the body's tissues. This can be caused by nutritional deficiencies, such as lack of iron or vitamin B12, blood loss due to excessive bleeding, or underlying medical conditions, such as chronic diseases or cancer. It's important to pay attention to other changes in health, such as shortness of breath, weakness, dizziness, or chest pain, which may accompany changes in tongue color. If you notice any of these changes, it's essential to consult a doctor for a comprehensive evaluation. These are just some of the signs that the tongue can present and their possible associations with health problems. It's important to note that these signs are not definitive diagnoses and may vary from person to person. If you notice any changes in your tongue that persist or are concerned about your health, it's important to consult a healthcare professional for proper evaluation and treatment. Always remember to take care of your oral and overall health by maintaining good oral hygiene, a balanced diet, and seeking medical attention when necessary. If you enjoyed this video and want to continue learning about oral health and well-being, don't forget to subscribe to our channel for more content like this. Click on the subscription button below and enable notifications so you don't miss any updates. Together, let's take care of our health simply and effectively. Subscribe now and be part of our community.